Hello everyone, a very good morning. Today we will go on with our basic science class D, as many of you have requested in our telegram group regarding acute phase proteins. So I have taken this topic. It is a very short topic and a very important question in your basic science also. Okay, yes. So what are acute phase proteins? So acute phase proteins are nothing but the proteins that are present in the blood which will increase during any inflammatory or neoplastic condition are called as acute phase proteins. So definition is the level of proteins in the blood that may increase in various inflammatory condition and a neoplastic condition are called as acute phase proteins. Here are few main acute phase proteins we are going to discuss. First one is your C-reactive protein, that is your CRP. C-reactive protein. Okay. This C-reactive protein, it is a beta globulin. Second, it is mainly synthesized in liver. It is mainly synthesized in your liver. Third point is it stimulates the complement activity and macrophage phagocytosis. So it stimulates complement activities and macrophage phagocytosis. This is very sensitive to the inflammatory condition. So once your inflammation is being subsided, the CRP will fall acutely. After that only your ESR will come down. Okay. So C-reactive protein, it is an acute phase protein which is a beta globulin synthesized in the liver, and it stimulates the complement activity and macrophage phagocytosis. Next, second acute phase protein is your ceruloplasmin. This ceruloplasmin, it is an alpha-2 globulin. So it is an alpha-2 globulin. It is mainly synthesized in, that is main part, or mainly synthesized in your hepatic parenchymal cells. It is in your liver. It is mainly synthesized by your hepatic parenchymal cells, and the small part is being synthesized by your lymphocytes and macrophages. Okay. So when all your ceruloplasmin levels will be increased, on which conditions? Mainly during the inflammatory condition, since it is an acute phase protein. So increased level ceruloplasmin are increased during your acute hepatitis. Second, when the child is having biliary cirrhosis. Third, during hemochromatosis. Fourth, during your collagen disorders. And even the drugs that can increase your ceruloplasmin are, so drugs that can increase your ceruloplasmin levels are your estrogen and contraceptives. These can increase your ceruloplasmin levels. In which conditions your ceruloplasmin is being decreased? So supposing if they ask a separate question regarding ceruloplasmin, so decreased level are seen in Wilson disease, malnutrition, and your nephrosis. Okay. If they ask a separate question, ceruloplasmin, you can write these points. Fine. Yes. Next, your third acute phase protein is your Alpha1 Antitrypsin. Third acute phase protein is your Alpha1 Antitrypsin. So this inhibits all your serine protease. So alpha-1 antitrypsin, it inhibits all serine proteases. Okay. So all serine proteases, meaning the proteases which has a serine as your active component, is called as serine proteases. For example, so your serine proteases are your plasmin, thrombin, trypsin, chymotrypsin, and your elastase. So these are examples of your serine proteases. This alpha-1 antitrypsin, this is also being synthesized in your liver. Right? Next, fourth, this thing, acute phase protein is your Alpha2 Macroglobulin. This is your fourth acute phase protein. So this Alpha2 Macroglobulin, it is a major component of your Alpha2 globulins. Second point, it is synthesized by hepatocytes and macrophages. So most of your acute phase proteins are synthesized in liver only. Okay, so these are synthesized by your hepatocytes and macrophages. It acts as an in vivo anticoagulant. So it is an in vivo anticoagulant. Well, all other proteins are being lost in urine during your nephrotic syndrome. Only your alpha-2 macroglobulin level will be increased in your nephrotic syndrome. Right? Yes. Next. So during inflammatory response, some proteins will decrease in the blood. So these are called as negative acute phase proteins. So which proteins are called as negative acute phase proteins? As like CRP, alpha-2 macroglobulin, alpha-1 antitrypsin, and celloplasmin, there are few other proteins which are being decreased during your inflammatory conditions. These are called as negative acute phase proteins. So examples are your albumin, prealbumin, and retinol binding protein, and your transferrin. This transferrin. So these are your negative phase acute proteins that are being decreased. The concentration of these proteins are decreased during your inflammatory conditions. Okay, so these are called as your acute phase proteins. So this is a very small topic regarding your acute phase proteins. Next video, many have requested regarding fever with rash. Okay, yes, so next video will make on how to approach a child with fever with rash. Okay, wow. Approach to child with fever with rash. Mainly I'll take it from your Nelson's pediatric decision making book. Fine. Yes, tomorrow or day after tomorrow I'll post that video. Thank you so much for your patient listening. Let's all learn pediatric together. Okay, thank you.